Hey everyone, and welcome. Today, we're going to talk about something that's super important, but maybe a little intimidating: complications during labor and delivery. The goal here is to walk through it all, step by step, so it's clear, understandable, and a lot less scary. Let's get into it. The birth of a child is just an incredible process, and for most people, it goes pretty smoothly. But every once in a while, the journey takes a little detour. And in those moments, understanding what's happening and knowing there's an expert medical team ready to handle those turns, well, that makes all the difference. So, one of the first bumps in the road can be all about timing. It's about when Libra decides to start. Is it showing up to the party too early, or maybe a little too late? Let's break down what both of those mean. What's really interesting here is how you're looking at two sides of the very same coin. On one side, you've got preterm labor, which is before 37 weeks. The baby isn't quite ready yet, so the whole goal is to hit the brakes and delay things. But on the other side, you have postterm labor, after 42 weeks, where the worry is that the placenta might be running out of steam. So in that case, the goal is the exact opposite. It's time to get things moving. So if the baby's trying to arrive too early, what do the doctors do? Well, the main goal is to calm down those uterine contractions. They use something called tocolytic therapy. The gold standard is magnesium sulfate, given through an IV. And what's really smart about this is that it's often a two-pronged attack. While they're trying to slow down labor, they might also give steroids to help the baby's lungs develop faster, just in case that early arrival is unavoidable. It's about buying precious time. Okay, so what about when the baby is staying put for too long? The big risk here is that the placenta, the baby's whole life support system, starts to become less effective. So the solution is to get labor started or induce it. This usually begins with getting the cervix ready using something called prostaglandins. Then they use oxytocin to get the contractions going. There's even a mechanical method called an amniotomy, which is basically just a fancy way of saying the doctor breaks the mother's water. All right, let's talk about what happens when labor starts on time, but then it kind of stalls out or takes a weird detour. This is what's known as dysfunctional labor, and the medical term for it is dystocia. Dystocia is actually a really helpful way to think about these problems. It just means difficult labor. And the cause almost always boils down to one of three things. I like to call them the three Ps: the powers, which are the contractions; the passenger, who is, of course, the baby; or the passage, which is the mother's pelvis. So when we talk about the powers or the contractions, they can go wrong in two main ways. On one side, you have hypertonic labor. This is like an engine revving way too high, but the car's not moving. The contractions are frequent and painful, but they're not coordinated or effective. The solution? Often, it's just rest, to let the uterus reset. Then you have the opposite, hypotonic labor. This is like an engine that just won't turn over. The contractions are too weak. And in that case, the treatment is to give them a boost, usually with oxytocin. Okay. So moving on from the powers to the passenger, one of the most common challenges during labor is all about the baby's position. You'd be surprised how much of a difference their orientation can make. And probably the most famous positioning issue is something called persistent occiput posterior. But most people just know it as back labor. It's exactly what it sounds like. Instead of the baby facing the mom's back, they're turned around, so the hard, bony back of their head is pressing right up against the mother's spine. And as you can imagine, that can make labor a lot longer and a whole lot more painful in the lower back. But what's so cool about this is that the solution isn't some high-tech procedure. There are real, active things the mother can do to help fix it. Things as simple as changing position. Getting on all fours uses gravity to help the baby rotate. Lying on your side, or doing a lunge. These simple movements can create more space and encourage the baby to turn, making a huge difference in pain and progress. It's really empowering. Okay, we're going to shift gears a little bit here. The things we've talked about so far are pretty common and very manageable. But now we're going to touch on a couple of rarer, more serious emergencies where a super fast expert response from the medical team is everything. The first one is called uterine inversion, and it is, believe it or not, exactly what it sounds like. After the baby is delivered, the uterus literally turns inside out. This is a true life-threatening medical emergency. And if you're wondering just how serious this is, look at that number, a 15% maternal mortality rate if this isn't spotted and treated right away. This is exactly why hospitals have emergency protocols and why rapid response is so critical. Every single second matters. But here's the crucial part. As scary as that is, there's a clear, decisive response called the Johnson maneuver. A doctor or midwife literally uses their hand to manually push the uterus right back into its proper position. It's a single, swift action that shows the incredible skill of a delivery team, and it is often life-saving. Okay, another one of these sudden emergencies is a prolapsed umbilical cord. This is when the cord, the baby's literal lifeline, slips down into the birth canal ahead of the baby. The immediate danger is that as the baby moves down, that lifeline gets pinched shut, which can cut off the baby's oxygen supply. And this is where you see a medical team spring into action like a well-oiled machine. It's a cascade of immediate, coordinated moves. The very first priority is getting the pressure off that cord. A nurse or doctor will manually lift the baby up, away from the cord, while someone else helps the mother change position to use gravity to their advantage. At the same time, they're giving mom oxygen and getting everything ready for an emergency C-section. It's an amazing display of teamwork. So I know we've just covered some pretty intense situations, and hearing about them can be a lot. But I really want to bring it back to this one central message. The takeaway here isn't meant to be fear. It's supposed to be confidence. Confidence that for every one of these challenges, there are plans, protocols, and incredibly skilled people ready to manage the situation. And that brings me to one last thing I want to leave you with. We've talked a lot about the medical side of things, right? The procedures, the science, but giving birth is also a huge emotional journey. So the question I want you to think about is this. Knowing how unpredictable this journey can be, how can we as a community, as partners, family, and friends, do a better job of supporting parents through this incredible and sometimes really challenging adventure? Thanks for joining me.